Whenever you talk about tissue diagnosis, bone biopsy is of paramount importance. Always done after clinico-radiological evaluation. Examine, do X-ray, MRI, then biopsy. Give a longitudinal incision along the axis. Avoid the neurovascular status. Go through the muscle. Make a round or an oval window to prevent any stress rises in a square window. Take a biopsy from the periphery because the center will have necrosis. Take from multiple sites. Whatever tissue you have, send it for cultures, send it for histopatha, and if required, send it for PCR or serology for mycobacterium.